Hello, my name is Ida Mae Kennedy. I am the Infection Prevention Nurse Manager at Santa Clara Valley Medical Center. Today I will be speaking to you about infection prevention. Three major topics that we will be covering will be the bloodborne pathogen exposure control plan, the TB exposure control plan, and finally, the most important intervention to prevent infections, hand hygiene. Bloodborne pathogen exposure should be the concern of anyone that works in the healthcare setting. The reason is because we do not know what our patients or clients may have, and therefore we must have plans in place to prevent exposure to whatever they may present with. The three major bloodborne pathogens we are concerned about is HIV, hepatitis C, and hepatitis B. There are other organisms that one should be concerned about, and they are bacteria or viruses. And the two common ones that you should be familiar with is the Zika virus and the Ebola virus. There are other potentially infectious materials, and they can be found in other body fluids, such as urine, spinal fluids, and even saliva. However, these fluids are only considered contagious if there are blood found within them. Persons who work in the lab are exposed to bloodborne pathogens through culture mediums, and they can also be exposed to animal blood that can harbor these viruses as well. How do you get exposed? Through direct contact, indirect contact, respiratory transmission, and vector-borne. The one that's most common is needle stick injuries, cuts from other sharp type equipment, and contact with mucous membrane. When we say contact of mucous membrane, we mean that you can have a splash that occurs in the eyes, or you can have exposure go directly into the mouth. As I said at the beginning, everyone in the healthcare setting is exposed to bloodborne pathogen. Therefore, you must know how you are exposed through identifying your risk. So, for example, if you are a first responder, you're the first on the scene, and you can be exposed to anyone that has a cut, an open wound, and other ways that the blood can come out of the body, either through vomit or through urine. The CDC estimates that 5.6 million workers in healthcare and related occupations are at risk. Therefore, it is very important that we go through this exposure control plan so that you know exactly what you need to do in the workplace to prevent the exposure. One of the things that we do as from an administrative standpoint is we make sure that you have the proper equipment. So as we talked about, needle stick is the most common form of bloodborne pathogen exposure, then we want to make sure that you have safe needles. And today, most of the needles that we use have a safety feature. At your facility, you may have a glide type feature, or you may have a plunger type feature, meaning you press onto the plunger of the syringe, and that will activate the safety feature. And the glide is one that you just slide the device over the point of the needle to prevent needle stick injuries. We also have bloodborne pathogen containers, what we call biohazard containers. And those containers tell you right away that whatever is in there can potentially expose you to a bloodborne pathogen. And of course, hand hygiene must be done before and after contact with any blood or body fluids. In addition to having sharp safety, we have what we call personal protective equipment. And they come in the form of masks, gloves, face shield, mouthpiece. And these are optional for you to choose based on what you're doing with the patient at the time. The best thing to do is always an assessment of what you are about to do for the patient. If you know you're going to walk into the patient's room and you are going to do a bed bath, how are you going to be exposed to potential body fluids? You might be exposed to urine from the patient, and therefore, what do you need to wear to protect you from being exposed to the urine? You will need to wear a gown and definitely gloves. If your patient is a known spitter, we have those at times, you might have to wear a face shield or safety goggles. So knowing ahead of time before you walk into the situation is very crucial so that you can put on the right personal protective equipment to protect yourself. Choosing the right equipment is one aspect of prevention. Knowing how to put it on is another aspect. So make sure that you know the proper sequence of donning and doffing your personal protective equipment. Another way to be exposed is if you have bloodborne pathogens in the surfaces where you work. Therefore, we have the OSHA requirement that says that you should not eat, drink, apply cosmetics in the area where these bloodborne pathogens can live. Example, on your keyboards at work, on the desktop. Those are places that can harbor bloodborne pathogens, and if you are eating or applying any cosmetics in those areas, you can potentially expose yourself to those organisms. It is extremely important, if there is a splash of blood or body fluids, that it's cleaned up immediately. I know a lot of people like to say, well, cleaning up is EVS job, but it is actually everyone's job, because if you see a spill on the floor, you may not have all the tools to clean it up, but by all means, you can at least get paper towel and cover up the spill and then contact the person that is responsible for removing the spill. We have what we call regulated waste, and these are wastes that our local county and our federal government have decided that these items must be placed in a biohazard container, and these items have to be treated in a particular way. So please make sure that you are familiar with what is regulated waste. And I will remind you that urine and feces are not regulated waste. The best way to know if something is a regulated waste is that it must contain blood. And are we talking about blood on a Band-Aid? No, blood on a Band-Aid is just minimal. So the item has to be soaked, saturated. I like to say if you can wring it, if you can flick it, it should go into a biohazard container. Your laundry does not go into a biohazard container. It goes into your linen hamper because it will go to a facility where it will be properly treated if it had any soiling of bloodborne pathogen on it. One other method of preventing exposure is through vaccination. We don't have vaccination for HIV, but we do have vaccination for the hepatitis, and so we ask that at the beginning of when you're first employed, you are given the option of having your hepatitis vaccine. If you decline initially, you can always change your mind anytime throughout your employment, and you can receive the vaccination. Please make sure that when you come to work, that if you have any break in your skin, that you cover it, because those potential breaks can put you at risk for exposure. And make sure that you are always following the procedures for safety when it comes to dealing with blood and body fluids. If you do get exposed, unfortunately, the first thing you want to do is wash the area. Please don't try to wash it with bleach. You want to use a mild soap. And if it gets into the eyes, please don't use any type of detergent. Just go to the nearest sink. If there is an eye station, that's even better. Go to the eye station and wash the eyes with copious amount of water. Then you want to report it immediately to your supervisor, who would assist you in going to employee health or to the emergency department for assistance. The slides reiterate the need for wearing appropriate PPE, but it is under the title Standard Universal Precautions. Standard Precautions says that you must treat everyone as if they are infectious. So don't assume because your patient may be handsome or pretty that they're not carrying a bloodborne pathogen virus or bacteria. They might be. Therefore, if you are going to do anything that will put you at risk to their body fluids, make sure you're wearing personal protective equipment. And of course, before you put on any PPE, clean your hands, and after you remove any PPE, clean your hands. Cleaning hands can be done in two ways. You can use hand sanitizers. Hand sanitizers, once you apply it to your hand, make sure that you put it over the entire portion of your hand, including in between the crevices of your fingers, and let it dry before you start any activity. For hand washing, you must make sure that your hands are wet first before you obtain soap, and then you lather for 15 seconds. So when you hear it takes 15 seconds to do hand hygiene, that 15 seconds is dedicated to the lathering and the lathering only. If you have an automatic faucet, then you don't need to worry about turning it off. You just put your hands under the running water when you're done lathering. You get a paper towel and dry. But if you have a faucet that you need to turn on, we advise that you use a paper towel to turn the water off when you're done washing your hands so that you don't pick up any organisms that you may place there when you first turned it on. Now let's talk about the transmission of tuberculosis. If you've been living in Santa Clara Valley County for any number of years, you will know that this county is really high in number of patients or persons that are positive for tuberculosis. Therefore, it is very important that we exercise what we call respiratory etiquette. So you want to make sure that people are covering their cough, whether it is a patient or it is a colleague. Make sure that everyone is practicing respiratory etiquette. How do you get exposed to TB? You have to be in a closed environment with someone that has active tuberculosis, and they can either be coughing, singing, talking, and these activities expels the droplets into the air, and then you come along and you breathe this air in. Now, it takes about 3 weeks before you might become symptomatic, but most people who are healthy, meaning they are not immunocompromised, will not develop TB as a result of an initial exposure. However, they can convert to a positive skin test if the exposure was determined long enough. Some of the symptoms that you want to pay attention to with a patient is making sure you ask about weight loss that's unexplained, if they're coughing up blood, if they're having night sweats. And sometimes there is fatigue and chest pain. So if you have a patient and you suspect TB, you don't need a doctor's order to put them in airborne isolation. You go ahead and you put them in airborne isolation, and then you contact your pulmonologist or your ID physician or the primary physician of the patient and let them know that the patient has been exhibiting some signs and symptoms of TB. They are in an airborne isolation room, and you would like to have the physician examine the patient and write an order to have this patient remain in airborne precautions. TB can locate itself anywhere in the body, but the exposure is true in the lungs because that is how it gets out into the air, and anyone passing or in a closed environment with that patient can be exposed. High-risk people that develop TB are usually people in institutions, like in jails or in nursing homes. Also, people who are homeless can have TB. And immigrants who come from countries where TB is an epidemic for that country. So those are some of the things that can clue you in to assess the patient for TB if they're coming from one of these institutions or countries that have TB. Patients that have diabetes, or they may have some type of head or neck cancer, or other immunosuppressed therapy they may be on immunosuppressed therapy, can also these are some predisposing factors to TB. So make sure when you're doing that initial assessment of the patient, you're taking all these things into consideration. People can have TB and not be ill and not contagious. Bacteria testing for TB is done using what we call AFB testing, and usually it is done through sputum. When you, as an employee, are tested for TB, you get a skin test, and if that skin test is negative, you will get a skin test every year. If that skin test becomes positive at any time, then you will get a chest x-ray initially to determine whether or not you have active TB. If your x-ray is normal, then what they will do on an annual basis is what we call a symptom check. So they will check in with you every year to see if you started to develop symptoms of TB. So if you have a weakened immune system, this causes what we call a breakdown of the wall that is protecting you from being active from TB or any communicable disease. So it is very important that you pay attention to your own lifestyle, making sure that you eat healthy, sleep at least 8 hours, exercise, so that you can keep your immune system healthy so that it can fight off any exposure that may happen to you during your work. So the hierarchy of infection prevention and control is administrative controls. Those are policies that we have in place to help you mitigate exposure to bloodborne pathogens and TB. Then we have environmental controls. For TB, we have the airborne isolation room is our big environmental control. We also have items such as the biohazard container for the bloodborne pathogen and our sharps containers. And then we have respiratory protection. Respiratory protection is mainly the N95. It's called a respirator, and you get fit tested to make sure that you are wearing the most appropriate respirator when you go into an airborne isolation room. When you have to remove a patient from airborne isolation, you need to make sure that you are in contact with either the pulmonologist, the infectious disease physician, and your infection prevention nurse, because they work in concert with the public health department to make sure that before we put this patient back into the general public or back into the hospital setting without the airborne isolation, that they are safe to go back into the general population. Therefore, do not discontinue isolation without an order. To end our presentation, we would like for you to view the video called Partnering to Heal. In this video, you will learn what is every healthcare provider's role in preventing the spread of infections. Thank you, and welcome to Santa Clara Valley Health and Hospital Systems.